Why'd you have to scare me?
Come on, Tony. Luckily.
You ready?
Please.
Yes.
Hello, everybody. Would you please all rise and join me in the Pledge of Allegiance? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God,
Indivisible, with liberty
and justice for all. Roll call, please.
Mike Alfieri,
Here.
Sonia Bragic,
Here.
Jennifer Bretz,
Here.
Diane Cibatoni,
Here.
Vince DiAugustine,
Here.
Jeannie Smith,
Here.
Paul Ward,
Here.
Scott Learn,
Here.
Tony Bompiani.
Here. Before we get started, I would like to inform you all that we met in executive session on July 20th after our board meeting, and no vote was taken afterwards. We're in executive session from 8:07 p.m. to discuss a legal issue. The executive session ended at 8:26. And then earlier today at 3:00 p.m., we went into an executive session at Excella Health. It was for information on different issues, but mostly the COVID situation. And that executive session lasted from 3:00 until 4:30 this afternoon. And then this evening, prior to our meeting, from 5:30 until 6:55, we're in executive session for legal and personnel issues. Sorry about this. So can we have the mission statement read, please?
Absolutely. The Hempfield Area School District and its commitment to excellence shall engage and educate all students for personal success through a shared responsibility with the student, family, and community in a safe, secure, and nurturing environment.
Okay, before we get to the superintendent's report, I wanted to make a couple of announcements. Number one, when any board members or anyone else with the team here wants to speak, please identify yourself before you speak so that the public that are on virtually can understand who is speaking at the time. I think it was confusing the last time. And I just want to say something before we get to this plan, which we're going to propose in your report, correct?
Correct.
Dr.
Yes.
Malicki? I just wanted to explain something to the public listening for our board. You know, if it was an individual, if it were an individual answer to this problem, how we go to school, how we open our schools, what are we going to try and do to make everything safe, we all have our own opinions, the 9 of us. And, you know, I have my opinion. I'm very strong in my opinion. I've raised my kids and my grandkids to be that way too. But I take this position very, very seriously. And I was explaining that to one of my sons the other day because we've had surveys. We know what the majority of the people want for their children, and they want their kids to return. We're elected to be concerned about every child that comes here. The children whose parents aren't afraid of this, the children whose parents aren't worried, send them. The ones that are following guidelines and want to do it strictly, we're concerned about them. The ones that are concerned or afraid for their health or afraid for people at home, we're concerned about those children probably the most because we don't want them to be impacted either throughout this. And we want to make sure everybody gets a fair shake. Having said that, I want to make one thing very clear. We are in a really tight situation budgetarily, as every school district is across this country. In Pennsylvania, children can go to cyber school. You've heard me say this before, and I don't care that you think I'm being redundant and keep hammering it, but I'm going to hammer it again. Every child that goes to another cyber school is hurting the school district monetarily. Now, I'm not saying that child's wrong or the parents are wrong. I'm just saying that there are some projections out there that a lot of children are going to go virtual. We have to take this under consideration. We don't want any of our parents or any of our children to be concerned. We are coming up with the best plan for everybody, and we have full confidence, especially after listening to Excella today, listening to Dr. Willicke talk about the program and others. And we have full confidence in what we're doing, that we're helping all of our children the best we possibly can, so that we don't have a parent concerned so much that they go somewhere else, because if they stay in our cyber school and do lesson bought along with that, they have a very easy chance of doing our curriculum and coming right back to school when this whole thing goes away, and it will go away someday, trust me. And if we do not open correctly, and we do cause confusion, and children do fall by the wayside, if we lose 5% to 10% of our children, like they have estimated from the state down to us, and there's waiting lists on private cyber schools, believe me, if we lose 5 to 10%, we're going to lose over $5 to over $10 million out of our budget. This year we didn't have to raise taxes. There's been a lot of hard work done by our business manager and everybody else. It's static right now. But I'm telling you, we lose that kind of money, plus what we have to pay to educate children in today's world. This school district and every other school district is in trouble, and public education is in trouble. So we're a team here working on this for your children. Please be a team member and work with us as much as you can. And I'll end with that. And Dr. Willicke, would you mind going to your report?
Thank you, Dr. Bompiani. Good evening, everyone. I will just first provide a brief introduction, and then Dr. Maloney will be presenting our plan, and Dr. Connor will provide an update on our cyber programming. So first, I would like to say we have had a team working for the past 3 months on the development of this plan. It has been the heart of our work every day over the last 3 months, and certainly the entire goal has really first and foremost revolved around the safety of our students and our staff. We recognize that any plan that we present will provide challenges. Certainly virtual, having all students instructed from home is certainly a challenge and not where we want to be, and certainly very happy that our county is not in the red, and certainly do not want that to occur in the future, but know that we need to be prepared in the event that that were to occur. We recognize the challenges for parents in a hybrid model. We realize that childcare becomes an issue. And we also recognize the fact that reopening for all children creates concern for parents in regards to their children returning to school. So there is no single plan that is best for everyone. However, the plan that we're going to share with you this evening does include choices. It's really revolving around choices for parents who would prefer the virtual, as Dr. Bompiani shared, and it's also around reducing risk. We have considered every aspect in how to reduce risk. Certainly the virtual opportunity for K through 12 for parents who are interested, and our feedback from our survey shared that we do need to make that more interactive. Our students who do participate in our cyber program, which is now K through 12, will certainly have more teacher interaction. Our hybrid model for phase 1, and when I say hybrid, that's for students in grades 6 through 12 who are attending every other day, will be looking at social distancing, and certainly in our elementary as well. And also really giving consideration to the order that was released on July 1st in regards to the wearing of masks. Our goal is to reopen school for all children, and that will be our phase 2. So this evening you will be hearing about phase 1 and phase 2, and certainly one of the bigger questions becomes when do we move to phase 2? When do all children return? And at this point, I have to say that that answer is unknown, because it truly is dependent upon the effectiveness of those measures that we're putting in place for phase 1. We hope that it can be sooner rather than later. Our plan in detail is 60+ pages long. I believe I saw 68 today. It is extremely detailed, from everything from food service to how are we serving the condiments, to looking at students using scanners rather than touching a keypad. We've had great discussions in regards to daily cleaning and what does that look like. We realize there are many questions, and certainly what you will hear this evening that Dr. Maloney will present in regards to our plan as an overview, there may still be questions. For that reason, there will be a form that will be available tomorrow, and the form will provide an opportunity for those questions to be asked, and we will respond to those questions on Friday, this Friday, August 7th at 2:00 p.m. in our second town hall meeting. The meeting will be aired virtually or in live streamed, and also available as a recording. I'd just like to state, too, that our plan has been reviewed. Certainly the physicians of Excella who were with us this afternoon, also by our solicitor, Michael Brungo, and also by Dr. James Masterson, who is also our school physician. So we greatly value the input that were provided by those individuals, as well as all of the team members. So with that, I'm going to turn it over to Dr. Maloney, who has had really taken a strong lead in putting this together for us, and greatly appreciate all of her work, and she will now present the plan.
Okay. Thank you, Dr. Walicki, and thank you, school board members, members of the community that are watching virtually, and other members in the audience today. I'm very proud of our plan that I'm presenting to you. As Dr. Walicki said, this was definitely a team approach. It took a lot of minds to come together with this, with these ideas. So, just to kind of go over what the plan looks like, the plan is actually in 4 parts. And by what I mean by that is the guidance that was given to us from the state comes in 4 different sections. But first I'm going to talk a little bit about the plan and then our process. We have to talk about cleaning, sanitizing, disinfecting, and ventilation in the plan. And a bigger section is the social distancing and other safety protocols. Another large part of the plan is the monitoring of student and staff health. And then the last part are other considerations for students and staff, which does include the face mask information. And then finally, I'll just kind of wrap it up. So our process, we really pulled together a lot of different people, not only people in our school community, but people outside of the community in the Hempfield area township. So we started with our department heads, department leaders. We've been meeting with them pretty much bi-weekly since we started outlining this plan, presenting to them and getting feedback. We also have, Dr. Connor has chaired our elementary cyber committee. And so we've really started to work on what does that look like, because prior to this, we had not had an elementary cyber program. Our cyber program was for grades 6 through 12, and I'll talk a little bit more about that when we get to that part. Educational Technology Committee, we are looking at, what do we have in terms of devices. As you know, we were one-to-one with our students in 6 through 12. During the shutdown, we were able to provide devices for some of our students in grades K through 5. So in order for this to work, we had to increase the number of devices that we were giving out to our students. Also, we worked with our teachers union, and collaborating with them to try to determine best practices and support. We've had transportation meetings. Transportation is a big part of this. It has one slide, but it's actually a lot bigger than that. Lots of different things to think about and lots of different specialized transportation for students. Also, we had a town hall meeting where Dr. Walicki answered a lot of questions, but after tonight's presentation, we're sure there'll be more questions. And as things in the county sort of change, people's mindsets change. So people may have different questions than they had the first town hall. So as Dr. Walicki said, that will be happening on Friday. We've also been working with our building principals who have really taken the lead in making this happen, this vision happen in the building level. So they've been working pretty diligently on that. And then we also have our health and social emotional committees, which include, as Dr. Walicki said, our medical professionals in the community, also the school nurses in the district, school counselors, school psychologists, school social worker, have all been working pretty diligently trying to meet those needs as well. So the first thing to talk about in the plan, it really separates into 2 sections. The red phase is if the county would go into a red, that means that all schools will be closed, but we would be able to proceed virtually. So, and it would look very different than what happened in the spring, because we at this point have been working very hard to update and make sure that we have the learning process that would be good for students at home with the lesson bot system and then the Google Classroom training for our teachers. So the yellow and green phases are really where we're talking about. The yellow phases are hybrid system, and in our green phase 1 is also mirrored. So our thinking there is that we really want to get into the buildings, determine what look at our systems, look at what's happening, look at our processes, make sure that our students are safe. We allow for a lot more social distancing in that green level 1, and I'll talk about that. And then if we're able to, if we have students that are healthy and teachers that are healthy, we'll move to the green phase 2, which would open up more fully, and I'll talk about that too. Our launch date here is set for August 11th, and that's because we will have students, with the approval of the board, coming in that Tuesday. We have assessments and things that we need to do with some of our students, so we need to put the launch date as August 11th, but our first day of school is August 27th. So I don't want that to be confusing, people to think we're moving up our start date. So when we talk about cleaning, disinfecting, sanitizing, and ventilation, this is one slide, but it's a lot of information. And really what we're looking at is a daily deep clean using our Victory sprayers. And I think we've talked about Victory sprayers before. They're very good at making sure that the areas are cleaned, especially in terms of germs and high touch points. So that will happen at least daily. We may do focus cleaning in areas where needed. So for example, last year, if we had some students with flu in certain areas of the district, they increased the amount of deep cleaning that they were able to do in those buildings. So our custodial staff keeps good track through our nurses on which areas we might need to be looking at more closely. We also, through a grant, purchased portable hand sanitizers and water fillers. So again, this is to decrease the amount of touch spaces and allow for students to be able to sanitize their hands, especially going in and out of cafeterias or different areas where they might have high touch points. Oop, went too far. So this is a big area here, the social distancing and other safety protocols. When you think about a lot of this plan, many pages are given to this section. And the first part of it is really talking about hygiene practices and signage. Our kids aren't used to different things that they're going to have to do when they come back to school, like wearing a mask in non-communal, in those communal areas. Washing their hands pretty regularly. We try to get kids to do that, but it's hard. And then washing your hand for 20 seconds. 20 seconds is long when you're washing your hands, so we really got to get kids into the habit of trying to do those things pretty regularly. So we will develop some video trainings for our parents and students to send out to them regarding these different things. Also, we're going to be showing them what are some symptoms to be looking out for, and I'll talk about that in a minute when a child is symptomatic, what the process will be. We also have, through the grant, we're going to be getting signage throughout the building to kind of talk about the different things that we want students to do, which would be, stay 6 feet apart, cough and sneeze in your sleeve, wear your mask, wash your hands. So those are things we're going to have posted throughout the building. The coordination of local childcare, we have the YMCA base in all 5 of our elementary schools, and that will continue. And they will also be getting us their protocols in order to maintain health and safety of our children. Identifying and restricting visitors. So we're not at this point allowing volunteers in the buildings in the green or yellow phases currently. Really, we want to kind of mitigate the number of people in the building. So just in case there is an outbreak of any type, that lessens the amount of contact tracing that we need to do. And it also lessens the amount of people that may be bringing things into the building. So we're also looking for certain agencies with collaboration, supervision of student teachers. Those are on a case-by-case basis. Obviously, we allow for those people to come in, but they will have to follow our safety protocols. Also, we're limiting the sharing of materials among students, and if students have to share materials for whatever reason, they'll be cleaning between uses. So we want it to be known that kids aren't going to be sharing different materials because, again, we don't want those touch points to occur. So the classroom in phase 1, and this is where Dr. Walicki talked about our mitigation strategies as being high for social distancing. And when we look at phase 1, it looks the same in yellow as it does in green phase 1. So what we're looking at is half-day kindergarten for our students, so that we're able to socially distance them in the classroom. In grades 1 to 5, we have our students coming every day, but they will be socially distanced in the classroom, and we're using space in the large areas like the gymnasium and the library in order to allow for that mitigation. So when students are in this 6 feet distancing, according to the guidelines that we were given, there are 3 exceptions to wearing the masks. One is when a child is eating or drinking, they don't have to wear a mask. When they're sitting in a classroom 6 feet apart, or when they're engaging in an activity 6 feet apart. So, we're hoping at this point our students can wear masks if they choose, and we can certainly encourage them to do that, but they won't be required to wear their mask if they're 6 feet apart. In grades 6 through 12, we're running on an A-B schedule. So our students will be attending in person every other day and then participating online on the opposite day. So they are still getting educated, and it will be through our classroom teachers through LessonBot, and it will be in real time. So the child can actually log into their classroom, look at what's happening in the classroom, and engage with students and teacher that day that they're not in the building. The thing I like about LessonBot is it's actually developed for students who don't come to school for attendance issues. So that when, and if you've seen a lot of the research on attendance, students who don't come to school have a higher risk of dropping out of school and having other issues. So, we're using it for COVID, but it also can be used for students being out of school for whatever reason, educational field trip, or, for whatever purpose that they're out of school. So we consider this a scaffolded reopening in green phase 1. In green phase 2, and like Dr. Willicke said, this will be dependent upon how successful we are in phase 1 and how we're able to, are students able to distance? Are they wearing their masks? Are we following the protocols that we have set out? Because we'll have less students to address on a day-to-day basis. When we bring everybody back, hopefully we'll have some good habits in place. So phase 2 is really opening up to a more traditional model. So our kindergarten students would come back all day. Our 1 through 5 students would no longer be in those repurposed gymnasium or library areas, and our high school students would be attending every day. So the cleaning and sanitizing all remains the same, and our protocols for health and safety remain the same as well. I think that the other big issue is we are going to change the 6 feet to 3 feet. As AAP, the American Academy of Pediatrics, has indicated, is where feasible. But also, the students will have to wear face masks at this point if the face mask mandate is still in effect. So that's the other reason when we kind of go to this point, we really want kids to be comfortable with the masks, understand why they're wearing them, have good habits in sanitizing when they're taking them on and off. And so until that mandate is lifted, our students, if they're within 6 feet, or I'm sorry, if they're less than 6 feet from each other, they will have to wear masks. So in phase 1, if they're in the classroom, they won't, because we're 6 feet apart. In phase 2, they will, because we'll be about 3 feet apart. So it's important to talk about our options for cyber, and I think this might be an area where people are still a little confused. We used to have, through Edgenuity, our 6 through 12 students were able to participate in cyber school through Hempfield. And that Edgenuity program is self-paced, asynchronous. And asynchronous just means that it can be happening, the student can be learning or doing activities even while a teacher isn't on the other side of that. So the student really is doing things on their own. Teacher sets up the program, corrects the grades, gives feedback, but it's not necessarily at the same time. So our elementary program, which we are calling the Hempfield Area Cyber Academy, HACA, we call that synchronous and asynchronous, because we will have situations where the student is actively engaged in a classroom that is live, but they also may be doing some things on their own that are more self-paced through the classroom. And the same for the other option for the secondary. So we're kind of expanding that elementary option to include our 6 through 12 students who would want to participate through LessonBot, who want it to be more synchronous, who want it to be more live. And these are the students that would most likely be returning to us when this is over, because it would be an easier transition because they'll be with our teachers in our curriculum. The Edgenuity program reflects the standards, but it's not necessarily our curriculum. It is our teachers, however. Anything? Okay. So one of the things that I think is kind of interesting is there's been a lot of work done regarding separating and doing it in a way that is still aesthetically pleasing. And so we still have these, we have these plexiglass dividers on the left side of your screen. They're actually sort of cubes. So if we have personnel who need to meet with a student in a closer contact, we still want 6 feet, but maybe they're doing an assessment, maybe they're doing a speech language group, maybe it's a reading specialist working with a child. That allows for that spacing between the child and the teacher. The other thing you can see here are the partitions. And so there's been a lot of really good work done. It's kind of separating out our gymnasiums and different areas of the school to make smaller classroom spaces and really allowing for that social distancing in the rooms. So as I said, transportation is a big project, and you know, it really, when we think about having our kids on buses, we know that we're not going to be able to socially distance our kids at 6 feet. So therefore, the kids who ride the buses will need to wear masks. So we are trying to limit the number of students on buses. So we have our high school drivers. High school students are able to drive. There is a waived fee this year. So as long as they have a license, I should preface that. Not anybody can drive. You do have to have a license to do that. And you can bring siblings and I believe neighbors with your parent permission. So we're trying to limit the number of those high school students on buses, and they seem pretty excited about that. I have a high schooler. He's very excited to drive his brother. Elementary and middle school students, we're asking parents to carpool when they can, and I think we have many parents who would prefer to do that actually at this point. So by doing that, we're able to open up bus runs for our elementary and middle school students who are not able to carpool or not able to drive. Well, they wouldn't be driving in middle school. I hope not. So our CWCTC students will be permitted to drive to and from the CWCTC. And, you know, if you've ever been in a carpool line for elementary school, you know that that can be kind of challenging. And so we have a new app that's a carpool app used in elementary to help that process. It's a good system. It was used at West Point, I believe, last year to great success. And so any kind of system we can do to be more efficient, we're excited about. Elementary principals are going to be working with assigning students to seats. We're going to have students start at the back of the bus and load the bus moving forward. We're going to have probably up to 2 students in a seat. That's the goal. But I think when we can, we'll try to have 1. And again, students are required to wear masks on the bus as long as the mask mandate is in effect. So in recess and physical education classes, I know a lot of people are worried about kids not getting recess, that not being the same. And the truth is kids will still be encouraged to go outside. We want them outside. They're not going to be able to use the playground equipment in phase 1. It's just too hard to make sure that that gets cleaned between uses. But they will be able to use some equipment, and as long as it's cleaned between uses. And we want students to wash their hands before and after. Phys ed class, you know, we certainly just want them to look at proximity to each other, length of time, you know, make sure that students are spread out when available. And the nice thing about outside is you can do that pretty well. We also have a district's health and safety plan with our athletics, which is very comprehensive, and so we would follow those guidelines, you know, when needed. Our cafeterias in the elementary school well, in all of our schools, I should say, have been replaced. The tables have been replaced with desks that are 6 feet apart. And so we do have some overflow, obviously, and then some classrooms will take those students that are overflowed in those areas. Elementary students will eat lunch either in their classroom or the cafeteria with the students they're with. And we will have the 6 feet signs for when they're going through the line. Students will be asked to wear their masks through the line and going to the cafeteria, but they will obviously take them off when it's time to eat. We have a lot of lunchroom protocols, so I would encourage you to look at our plan because it really goes into pretty great detail about all the different things that we're doing to individualize that experience for the children. Lots of signage on the floor. We're going to have touchless payment systems, concentrated cleaning between servings, and really we'll only have 1 line open, but because we'll be staggering some of the scheduling, it will move smoothly. In some of the schools, not all of them, because some of them align with this a little better, we will have one directional, so we'll have kids maybe moving in one direction. Some of our bigger schools that are shaped like a square, that might work, but if you ever have been to Maxwell, it's just one big, long hallway, and it's not gonna work there. So the principals have been working very diligently on what makes sense in trying to keep kids in certain hallways so we don't have a lot of crossover. So this next section is, it's really probably an area that I think a lot of people have questions about. When we're looking at monitoring student and staff health, we're taking it very seriously. We want our kids to be safe and healthy. We want our staff to be safe and healthy. We want our community members to be safe and healthy. So we're trying to make sure that we're doing mitigation strategies that support those goals. So I'm just gonna So the first thing we're doing is universal precautions. We're asking all of our staff, students, visitors, anyone who comes into our buildings to follow these guidelines. First of all, we want people to stay home if they have symptoms. And if students come to school symptomatic, we'll be sending them home. We want kids to be in school, but we also don't want students to accidentally spread if they have COVID. We want students and staff to remain 6 feet distance from each other. That's kind of key, and I'll talk to you about why that's key, especially in this first phase here in a few minutes. When distance cannot be maintained, we're asking students to wear masks. Masks do mitigate the virus. We just met with a bunch of doctors at Excella today who supported that. And it really is important that we become comfortable with the mask mandate. We also want people to practice good hygiene, hand washing, refraining from touching your face, and that's hard, especially for some of our younger students. So we'll just be reminding them, to do that. And then we also need to report any exposure to our principal or a nurse, or if it's a staff member, to the supervisor or the HR, to Mr. Rieger. So, when we start talking about what happens if someone's sick, you'll see why the 6 feet, masking, and the time frame become very important. So the first thing we think about is the monitoring staff and students for symptoms. So one of the things that people want to know, are we taking temps every day? We are not going to take temps in our buildings every day. With the number of students that we have, we would be spending a lot of time doing that, and we would be worried about any kind of lag where students are standing around each other. So that is something we're going to be asking parents to do at home. So if your child has a temperature, we want you to keep them home. If the temperature, our policy for students is 100 degrees. If that temperature is that high, then the child would stay home. And then you would report, of symptoms to your child's nurse and principal. We also are asking our staff the same thing. To stay home when they have symptoms, especially if they have a fever. I think that, so one of the things, so when we get into monitoring that, that's a pretty key part. So if somebody comes to school and becomes sick, we have a process for that, but what we don't want is for people to come who've been sick. That just, that's can be problematic for us. So we're isolating or quarantining students, staff, or visitors if they become sick. So if a child or a staff member in the duration of the school day begins to feel ill, we will have a protocol to reach out to the nurse's office to have that child be assessed. So something to keep in mind is our teachers are able to maintain that 6 feet of distance and wear masks. We want students who are coming into the nurse's office, if they don't have a mask on, to put on a mask and sanitize. If they are ill, they will be taken to a sick area. We have areas that are set specifically for the purpose of children who are symptomatic. And then we have areas in our nurse's office that are set for well. And those are for children who need medication management, who have diabetic management, whatever they need for medical care throughout the day. But those two areas are very separate. And so what we'll do at that time, the nurse will put on PPE to assess that child, because of course the nurse at that time cannot be 6 feet distanced at that point. And then of course, once that child is assessed and determined to have symptoms, then they will be sent home. So one of the key things we would want is for parents to make sure their emergency cards are updated. At the beginning of the year, we'll be sending a letter out just asking that those emergency cards are updated and that people who are on the emergency card are able to come get the child easily. Also, a big question a lot of people have is what happens if we have a positive case? And so returning isolated or quarantined staff, students, or visitors to school. So we have separated out, and I'll show you in the next slide, the different levels based on our experience and CDC guidelines that really talk about the difference between a possible exposure versus a known positive case. And unfortunately, because of the lag time between a lot of the testing, you could be a presumptive case, meaning that maybe you have symptoms and you think you're positive, but you take a test and you're waiting to hear, and maybe not be a known case. So some of that makes it a little complicated in this setting when we're dealing with so many people being in our schools. So the different areas we talk about are the possible exposure. So of course, travel, you've heard a lot about travel, that's a possible exposure. And there's really no mitigation other than just using best practices. Same with possible, if somebody you work with was tested or presumptive, but you were never within 6 feet, you followed the guidelines and you stayed within 6 feet, you were never within 15 minutes, that may be a possible exposure, but it's not known. A person who's a known risk is a person who has been, either because they live with the person who's symptomatic and positive, or they were close to that person, maybe during a school day, they were not within 6 feet, they spent time with that person, and they were not masked. And the presumptive positive, obviously, is the person waiting to be tested, and a positive case is then when you have the result. So you may have a person who has symptoms, who thinks they might be sick, but that's not a positive case. And that's where it starts to get really tricky and confusing around when do you quarantine, when do you send, so we would always, and I'll talk about this in a future slide, we will always be consulting with Department of Health. And then in times when the Department of Health knows of a case and we don't know about it, they will be reaching out to us. So it's the Department of Health or our county municipal health department, because we don't have a county Department of Health. It would be the county municipal health department, and they're in Greensburg. So I put this slide up here because, again, it's that close contact and how is it defined by the Department of Health. And this image here is actually from the Department of Health's website. And so if a person has a positive case, they obviously have to isolate. If a person who has a positive case had close contact, now remember that means either they've lived with a person who has a positive case or they were within distance over a period of time, then they would need to quarantine. And then the last is a person who may have been around somebody, but they socially distanced and they were able to stay away. That is a contact of a contact, and they would just do best preventative measures. So the other thing to keep in mind, again, I put the definition here. It's 6 feet, 15 minutes or more. So if you're within 6 feet for 15 minutes or more, that's a close contact. Or if a person coughs or sneezes, even within 6 feet, then that could also be a close contact. So when we communicate that, we will again be partnering with our Department of Health to determine what is the best approach, what kind of contact tracing needs to happen, who needs to be informed. So I kind of liken this to when we have different contagious illnesses in the district, and Department of Health has to send a letter to families. The important thing to keep in mind is that only happens with a positive known case. So I think that can be where it's confusing, because you may have a person who is symptomatic or presumptive, meaning they're waiting on testing. We wouldn't necessarily make an announcement about that because we don't have a known case. So again, I just want that to be known. It's not that we're trying to hide something. It would just be that we have to wait for that confirmation. Certainly we would, if there's danger to students or to staff or to any other personnel, we would notify them. But that's where it gets a little tricky because of the time lag between the testing. We also have to think about student and staff privacy issues under FERPA and other laws protecting them. So the very last section here is the other considerations This is where we talk about face masks. And this is one of the big areas that was adjusted after the June 17th guidance that came out. Because it became very clear to us that schools were not immune to that mask mandate and that we had to abide by the 6 feet or you have to have a mask on. So for phase 1, green and yellow, because our students will be within 6 feet apart, when they're sitting at their desks, when they're eating or drinking, or if they're engaged in an activity and they're able to be 6 feet apart, they do not have to have their masks on. They certainly can keep them on. We would encourage them to do that if they wish, but they don't have to. In the health room, if a student is being assessed by a medical professional, they need to have a mask on. And then on the bus, because again, they can't be socially distanced, they would need to have a mask on. The exceptions to this, under the new guidance, is that if a child is not able to wear a mask, then it needs to be connected back to a disability through IDEA or the Section 504 of Rehabilitation Act. And so, a student, that certainly could be the case. And we talk a little bit about face shields. Some of our medical professionals encouraged, said, prefer masks. Masks are actually the better barrier. But if you have people who can't wear masks, they can wear shields. But the shields must come below their chin and they must wrap like around the head. So certainly children who cannot wear, have difficulty for whatever reason, could also then wear shields, and same with staff. So, we have students and staff that are at higher risk with severe illness. Maybe they're in a category of, that they may have comorbidity issues. And then also we have students who are medically, have medical issues or complex needs. And so those are actually very individualized decisions that need to be made very thoughtfully by IEP teams or 504 teams, or if it's a staff member reaching out directly to our HR director, Mr. Rieger, because to say this is what we're going to do with all of these children is not fair and certainly needs to be very individualized. We're also going to be looking at our strategic deployment of staff. Our elementary teachers are going to be taking their planned time at the beginning of the day in order for us to allow for the specialists to cover, to be working with the children in the large group areas like the gymnasiums and the library. All of our teachers will be using the lesson bot. In some grades, probably more than others. And then, we will be addressing the behavior, emotional, social, and mental health issues that have really kind of come up because of COVID and, the closure and coming back to school. So we have some things in play. We have a committee of, teachers, school counselors, school psychologists, our home and school visitor, myself, some of our principals, talking about what does this look like when we bring our students back? What kind of tier 1 universal intervention can we provide? And then what else is needed for students who show more risk? And what do we have to offer? And what resources in the community can we offer to our families and students? So this is in the works. We aren't quite mapped this out yet. But it is an area that we are certainly looking at very strongly, and I have a lot of good people on it. So finally, we're really looking at the safety protocols. We receive a lot of guidance documents, and then there's a difference between guidance documents and mandates. And so we really try to find our way through those things and think about what's best. We really understand the need to be flexible at this time. Things seem to be changing differently depending upon what's happening within a week. And, we certainly will continue to communicate those changes or anything that comes up. We will let you know, certainly as soon as we know if something has to be different with this plan. So that's just kind of like an overview of the plan. And I guess now I will open it for questions.
Before you, okay. This is Tony Bompiani talking. Before we move on to board questions, I just had a couple of them. As I listened to the presentation, which is excellent, I think that all board members would agree, and I would hope the whole public out there agrees, that the presentation was excellent. And the time, the preparation you put in, and I can't believe it, only 5 pages were added after Dr. Masterson. Is that true?
I
I think about that.
it was pretty comprehensive.
But
before
in
my
any
time.
event, as I listen to it, and I would assume some of the parents out there, I want to make sure that they understand there's a positive end to this, because we went through a lot of restrictions, a lot of restrictive things that they're put down to us by the state, and there's a conception out there in the public that I've heard a lot about. Other school districts are opening up without any restrictions. Well, that can't be completely true, correct?
I don't know what their resources are, so it's hard for me to say what exactly they're doing. So
Okay,
I've been
but
kind
our
of busy on this
restrictions,
plan.
our restrictions, including the face masks, are based on the mandates and what is
Correct.
told to us.
That is correct. So the mandate of face mask, and in the guidance, it says there are exceptions, which I have listed.
And you've listed them, and we're going to abide by them.
Absolutely.
And I'm not gonna put words in your mouth, Dr. Maloney, but at the same time, I would ask this to Dr. Walicki. We want to get back to normal as quick as we can, correct?
Absolutely.
And in 2 weeks' time, after we've been in this program, if we've had no outbreaks and things are relaxed and things are going well, we're going to look at going to the green phase.
I'm going to give up this chair right now, Dr. Bompiani, to Dr. Walicki.
Well, I thought you wanted questions.
That's a question.
I guess
don't
it's
think
above
can
her pay
answer.
grade, folks.
I don't think I can answer that.
I think that the timeline is the question, and I think that while 2 weeks would be wonderful, it's something we just cannot state that is for certain. It's going to depend on what occurs. We don't know what will happen when we bring all the children back. Certainly all the safety measures will be in place, and if we have no cases, then certainly we would look at bringing others back.
Right,
So
and I'm
2
not
weeks is just a guideline. I think that's just a concern that we can't state for sure that phase 2 will begin after 2 weeks.
For sure, I don't want anybody to take false positives from what I'm saying. I'm not trying to paint a picture of rosiness, because I'm very frustrated, like everybody else is, about the lack of some of the direction from up above to us. It started in March when we were given a directive to close the first time. So I have that frustration too, and my frustration, I don't want us to cause any confusion. I want the public to know we're going to look at this as soon as we can, whether it's 2 weeks, 4 weeks, 6 weeks, whatever it might be.
We will be monitoring every day what's occurring within our buildings.
And our goal is to get
Yes.
back to normal as soon
Absolutely.
as we can.
Absolutely, yes.
But this plan, as I see it, and I think we all see it, we are well excited about this, because this plan gives us the best chance of having our children get to that normalcy. And not only that, when we met today with Excella, we talked to their psychology department, was that what you would call that? Behavioral health. And they talked about socialization of children, and the younger children especially. They need interaction, and a lot of children that are out there are not having interaction with children their age, which is causing a lot of anxiety in these kids and causing problems. Right, Dr. Molina? That's what they said. Right, so we want these children back to school. This is the best way to get them back to school on a graduated plan, so that they can come here safely. And it also keeps the children in the loop with our curriculum, which allows them to do that, correct?
Correct.
And that's the beauty about this plan. And the face mask order, when we go to the green phase and it's 3 feet, we're going by an order by the governor, by the state, correct?
Correct. That's correct.
If that's relaxed by then, that goes away too, correct?
Correct.
Okay.
That's
Those were my questions, and we'll go to the board members. Just announce your name, who you are, and go ahead and ask questions if you have them. And to the public, you'll be able to ask your questions by sending emails to the district.
No, there will be a
For-
form that will be available on our website, so we ask
Okay.
that you use the form just because it will categorize our questions, just so that we're not duplicative as we're responding. So
And
that
they'll-
form will be on our website tomorrow. Mrs. Gibasevich already has it ready to go. It'll be posted in the morning.
And Pam can't wait to do the work, so that'll be
Yes.
answered on Friday at 2 o'clock.
Correct, yes.
Mike?
Yeah, Mike. This is Mike Alfieri talking here. I just wanted to reiterate today from what we got with meeting with the Excella folks. They really praised our plan, and it's purely on the administration with Tammy leading the way and Dr. Maloney. And what I really found interesting was the importance, the fact that the kids need to interact with their peers is very concerning to them. And what I gathered was it's more concerning than the kids catching the virus, because it has long-term mental aspects of developmental kids, especially K through 6, and that's why I personally I'm weary about the cyber aspect, because there's nothing like an in-person education. We all know that. So I just want the people out there listening to really think about that. And this plan is probably the least cumbersome for the teachers and staff and students as it can be. But I just want them to remember, the parents especially, to remember that it's extremely important for the social interaction for these young kids.
If I can share too, the fact that we do have band camp started today, sectionals started 2 weeks ago, athletics are in operation, so we already have started to bring students back onto the campus, certainly with safety measures in place. So that is allowing us to have an opportunity already to see how things are working, and certainly to date, we've had no issues, and certainly hope that that continues.
Other questions from board members? Vince?
Yeah, Tony. There? Okay, good. Vince DeAugustine. Just when we talk about cyber, if you're attending our cyber school and you want to opt out, that's an easy transition, right? So opt in, opt out from our cyber program back into the classroom.
That would be an easier transition, correct, because the curriculum would be the same. So wherever you were at that point in the curriculum virtually, you would just transition to that in brick and mortar. Yes.
Okay. And the other ones, whether it be PA Cyber or any of that, there's a whole process with opting in and opting out.
It would be a transition because it would not be the same schedule, the same courses necessarily, the same resources, materials, teachers. It would be very different.
Okay.
Yes.
Thank you.
Jeannie?
I have a question. I don't know if you're going to be able to answer it tonight, but I was wondering about the air in the classrooms and the filtering systems that have we changed that? This is Jeannie Smith, sorry. Have we done anything to enhance that or made changes because of the COVID-19?
And Wayne Wismar, a business manager, will respond to that question.
We have been working at improving the quality of airflow, particularly throughout the district over the last several years. So this isn't something that we just started to work on because of COVID. It's something that we continue to work on. We do have good turnover within the room, certainly well within guidelines. It gets turned over from outside to inside. And we have the ability through our programming to actually open up the dampers to the outside and even increase that airflow. So we have gone through, particularly at the high school, all the unit vents have been cleaned, all the filters have been cleaned. We do that throughout the entire district as far as the filters as part of our summer cleaning process. And we're looking at how we can increase dampers, on the unit vents to improve the airflow. And the other thing that they've even recommended is, when possible or practical, to open windows to improve airflow. But typically, buildings aren't airtight by any means. There's a lot of movement in and out, so airflow is typically not an issue. And I'd say with the deep cleaning that's taken place at all buildings, I think the air quality, which is a pretty broad term, is going to be very good to start the school year.
Thank you.
Sonia?
Yes, Sonia Bradjic here. Couple questions I would have just from dealing with some of the players on the team. Obviously, been asking some questions. Have schedules been put out for some of the students? Because it appears some of them seem to know an A-B schedule, and I'm thinking some of them are just maybe speculating what that schedule would be. They feel that if they're at the beginning of the alphabet or at the end. So is there any idea, or has their schedule been put out yet, would be question one.
Dr. Matt Connor, our Assistant Superintendent for Secondary, will answer that question.
Thank you. At the high school level, it is strictly by the alphabet. So the students can probably take a very good guess and determine their
Okay.
AB designation. Their actual schedule has not been finalized yet. The middle school is a little bit different. Those letters should be actually in the mail as we speak. It's snail mail, so it will take a few days to get home to parents. And we were asking parents to make sure if they have siblings in both high school and middle school to verify and help us out, because we may have missed a kid, but we're trying to align that to help families as best as possible.
And then the other comment, which I understand why, but maybe people out in the public don't understand why. Some people have questioned, rather than an A-B, why can't our students go Monday, Wednesday? And they're always on a Monday, Wednesday schedule. Or why can't they go on a Thursday, Tuesday, Thursday schedule? So we always know that our kids are in school these days and everybody be off this day. So, and I know the nature of our 6-day cycle, but maybe perhaps we could explain that so the parents out there, that would be a question that would be avoided.
Yes. So in a typical school year, our students operate on a 6-day schedule. So certainly in the first week, if there's a full week of school, Friday would be day 5, Monday would be day 6. So already we follow that sequence that is not necessarily by the day of the week. Our goal in developing the AB schedule is to have students in school as much as possible. I'm aware that some districts have students coming Monday, Tuesday, everyone's off Wednesday, and then other students on Thursday, Friday. We feel that our students will be more consistent and more accountable if they're coming every other day, because then the work that they're expected to do on the day that they're not at school certainly will be expected to be completed when they return. As far as opportunities for cleaning, we are cleaning every day, so therefore we do not need a day where we're closing school to clean. Our buildings will be cleaned on a daily basis.
Thank you. Like I said, thank you. I think that maybe answers some questions that some parents might have had out there.
Thank you.
Thank you, Dr. Willicke.
Scott?
Scott Learn. I don't have any major questions, but I would like to say that I think the administration and the staff that put this plan together should be commended. I think just waiting a little bit after we got the second set of directives and things, I think that was a smart move. There's no prizes for getting the plan out there, be the first one out with the plan. And I think we did a great job. I'd like to commend the board. I know some met with Excella today. What a great idea. Being in the medical field, I've been dealing with it firsthand. And I think what better to ask the experts in the community to ask what we need to do to bring the students back safely. So thank you.
Thank you, Dr. Learn. I'd like to state, too, in the event that we receive further guidance, there's certainly the possibility that we will be revisiting and revising our plan. So just so everyone knows, this is our plan currently, and the plan is that it will be voted upon next Monday, 1 week from today. Thank you.
Paul?
This is Paul Ward. So, Dr. Willicke, you had mentioned that, just mentioned about cleaning every day, and I thought I had made a note, thinking back to probably a month or two ago, there was a presentation, and I think it may have gotten lost, but I think it's worth highlighting that last school year, the district had implemented new equipment to clean, and it was a proactive. I know you were doing it during the flu season before COVID even came along. So I think it's worth highlighting this new system that is. It seems like it's a pretty good way to clean the classrooms, and I think it's worth highlighting.
Very good. So Walt Edged started in October 2019 with the use of the Victory sprayer, which allows a classroom, certainly the surface areas, but certainly areas that you wouldn't necessarily be wiping with a cloth, to quickly be disinfected. It is known to kill the coronavirus, which is certainly very important given our circumstances, in a very efficient manner. I'll use an example. We had 2 graduation ceremonies and limited time in between the ceremonies. The Victory sprayer does come as a backpack, and we were able to clean the stands in between those 2 ceremonies in a rather efficient manner. So certainly we are continuously looking at what products are available, what products are being recommended, and using the best product that we can in the most efficient manner to maintain cleanliness throughout all of our buildings. We're certainly looking at our buses as additional areas, certainly our cafeterias. restrooms, those high-touch areas, to be sure that we are maintaining a clean area for all students.
And I guess, just to follow up on that, you mentioned graduation, so there were over, 450 graduates and a lot of people there, so that seemed to have been successfully accomplished without having any issues virus-wise, correct? So I
Correct. So
think it's worth
we held
highlighting.
the 250 maximum that we were permitted within each of our stadium sections. And yes, there, to our knowledge, we had no issues and certainly cleaned effectively. And we were able to have certainly a great ceremony for our seniors, which they certainly waited for, but it was well-deserved for them.
That was really the point, was just to highlight that
Yeah.
things can be done, and if they're done the right way and with the diligence. And I guess to Dr. Learn's comments, I would compliment the administration as well. A lot of great work, and I know it's been a lot of hard work, but you've been very busy summer, but you've done a lot, all of you, so kudos.
We have a great team, we do. Thank you for the support from our school board.
Jennifer?
This is Jennifer Bratz. I do have concerns, by Governor Wolf, the children are supposed to be, wearing the mask, and while that mandate is in effect, just about the children going back and forth to, on the buses. We know that children don't necessarily like to keep these masks on. How are you going to keep the mask on the children? Is there somebody that's going to be monitoring the children in the hallways? Is there going to be staff or teachers represented to monitor the children, that they would be able to, keep those masks on?
So certainly, we view it as it's a rule just as we have other rules. No running in the hallways, for example. And certainly any staff member who would see a student breaking a rule would be encouraged to reinforce that rule with that student. So certainly, I envision there to be lots of reminders if we see someone, and I think the modeling of our staff will certainly be of great value too for our students to know the expectations. So certainly that will be shared as an expectation and then reinforced with all staff members.
And what about the bus situation? Right. I mean, who's monitoring the kids on the bus? Is it the bus driver, or is there somebody else?
There is only the bus driver, the only adult that's on the bus, but certainly we're looking at, our goal is to have one student per seat. I'm not sure that we're going to be able to accomplish that on each and every run. That's why we say up to 2 students. But certainly as the students are getting on the bus driver would be able to encourage them at that point to make sure that their mask is on. And certainly if the bus driver, now their primary goal is to drive the bus and the safety of the bus, and currently if a student does not follow a rule on the bus, the driver does attempt to address it, but certainly that is turned over to the building principal if necessary. So we would continue to have the bus driver be the monitor and the one to report that, just as they do for any other bus rule that would be broken.
And, when I was younger, I mean, we would be, if we didn't follow, certain guidelines, we would get detention. And if the kids aren't, students aren't following certain guidelines, would there be warnings? Would they get detention?
I think absolutely. First, there would be encouragement in order for them to follow the rules. And then just with other rules, there have to be consequences. And those consequences vary depending upon, the frequency and certainly what the role would be. So certainly we do envision, and I hope that our students, and along with our parent support, will encourage students to wear the mask, because it's really for their own safety and the safety of others. I think we all recognize the fact that it's all about reducing risk. So the more that we all work together to encourage students to wear the mask and to have those consequences as necessary, it will then just allow us to keep our schools open for a longer period of time, hopefully not have to close them.
Hello, Jen. Just a point of clarification on that mask and the discipline. We're not looking to add another rule to discipline children.
Right.
And you're certainly going to weigh whether that child's doing it for a reason because he can't take the mask. Or
Correct.
he's not trying to be belligerent or something. I don't want parents out there thinking, we're
Very
going to
good
use this
point.
to start disciplining
That's
them
right.
and putting them in detention, because detention's got to be social distance too. We'll have
That's right.
everybody in there, and
You're
nobody
right,
will be
Dr.
safe.
Bompiani.
Diane?
And there may be children who cannot wear a mask, and certainly those are the children that we need to hold those parent meetings in order to make those determinations as to whether they qualify to be excluded from wearing a mask or to wear a face shield. So
And again,
certainly
we'll-
working through those situations.
And we'll be diligent to listen to, understand, and deliberate with the government, what their restrictions are and their mandates are, and then come up with what we have to do for your children, not push things on them, right? So Diane, go ahead.
Diane Cipottone. I think we have the best of both worlds here. I'm very, very pleased with the plan, and I congratulate the team for what they did. And after meeting with Excella people today, that even confirmed that this is a really good plan, and thank you for doing this.
Again, team effort. We have a great team.
Any follow-up questions from board members? Jeannie, go ahead.
This is Jeannie Smith. To tag on to what Sonia asked about the schedules. Excuse me. If someone's trying to carpool and they happen to be assigned to different A or B, are you going to work with them to try to accommodate that?
That could be a challenge because we do have the buses available that if they cannot carpool because they're on a different schedule, there's certainly the option of riding the bus. Our largest classroom, when we look at the distance, we can, in the larger classrooms, seat up to 17 students 6 feet apart. So especially at the high school, when you start to have classes to where the numbers in some of our classes push closer to 30, it would be a challenge to make changes based upon carpool when we have to look at the number of seats that are available and maintaining that social distance. So I would say that it's possible that we would have to rely upon our busing, and the buses will run all routes every day. So therefore, if a student's carpool does not naturally fit with their schedule, they could still ride the bus.
And how is that working with the teams at the middle school? The assignments, the
So-
AB assignment.
So the principals at the middle school really went through by team in order to balance. They were really looking at what students are in some of the advanced math classes and being sure that those classes were balanced as well. And then really doing it on, I want to say almost an alternating fashion in order to be sure that the teams had an equal number attending each day.
It was a lot of hand scheduling, and I have
It
to tip
was.
my hat to the middle school principals going through each of
Yes.
those classes and the way they did. I mean, they really busted their butts to get to that point.
And then I also have to compliment the administration on this plan. I think it's a brilliant plan and offers a lot of options. And it does allow us to return to complete normal without skipping much of a beat. So thank you for all the work you did on this.
Again, team effort.
Any other follow-up questions? Tammy, I don't know if it's appropriate time before you get to the next section, but you had mentioned about the quarantining, and we're not going to quarantine people traveling.
Correct. That was a question that we even posed to
But
the.
I'm talking in relation to now athletics too, because there's confusion out there. Because
It's currently in our athletics plan. It's still a part of our current plan in phases 1 and 2. And I'm looking at Mr. Rapp to see if it's in phase 3, because it is voluntary. Participation in conditioning is voluntary. So we're going to have an athletic committee meeting. We're going to be looking at a date as soon as I talk with Mr. Ward here this evening at next week to start to roll out phase 4. So I thought at first you were talking about with our staff, but with our students for
I just was-
athletics.
I was
yeah.
talking about the difference of the two and why that's really fair.
So whenever we worked on our plan, our athletics plan that we brought before the board July 20th for phases 1 and 2, at that time, that's whenever the travel restrictions, the recommendations were recently released. So at that time, we looked at it as conditioning is voluntary, and therefore we did include that restriction for our athletes. So certainly, as we look at our next meeting and building forward the next part of the plan, we could consider then making that change at that point. Just maybe based upon the recommendations that we had today from Excella.
Okay.
That's another area where, you have to make decisions based upon the information that you have at the time. And certainly whenever that information came out, there were many questions. How does that apply to staff? How does that apply to students? And I think it's something as we're now getting more confirmation, yes, it's a recommendation. And even today, hearing that Excella does not reinforce that with their own staff, I thought the example that was shared was excellent in stating that it's all about risk. You could certainly travel to one of those areas, but not be putting yourself in a situation where you're in contact with a lot of other people, where you could stay here in Pennsylvania or here in the city of Greensburg and spend some time at a bar where you're actually in close contact with others and putting yourself at more risk. So I think that's something that after today's information, we will certainly take back, just as there may be new information we may receive in the upcoming weeks that we will come back and incorporate into our plan.
So, and I'm going to ask something totally out of character for me, because I believe in following what we've put in place and giving the administration time to do certain things. But on the outside, it can look like we're picking on athletics, but we're not picking on academics. And we have, no,
It's
let me
this-
finish. What it really concerns me is this is during summertime, while children are at least trying to go on vacations and things with their parents, and then all of a sudden they're coming back and they have to quarantine. So I'm just saying, if they're, after listening to Excella, after listening to our plan, and we have these restrictions, who would be offended if we just suspended the rules and said we're not gonna follow that anymore? Or am I out of line with this? If I am, we'll quit the discussion now, we'll move on to the next time.
So I think we should revise our plan because it is a part of the board-approved plan. And I think that gives us an opportunity because it's not just, and I wanted to share, it's not just athletics, it's our band as well that's impacted. So I think we need to look at it for all student
And
activities.
that'll be by next Monday, we'll be able to do it.
Well, our athletic committee meeting we're looking at is next week, so it would be for the following week for the 17th.
Okay.
So correct, so this is Sonia Bragic, so you're saying then that even though the recommendation out there is that if somebody travels to a hot spot and is supposed to quarantine, and while I understand certain hot spots, I could go visit my son in a hot spot state and not go out, I could stay in his home. But what about the people that go to the beach at the hot spot and then come back and are around people? That's a fine line that we're walking there.
Sonia, I hear, and I think you're addressing me with that. I'm not even talking about trying to determine who can do what and where, when, and how. I think the government's done that with their recommendations. I am just saying it doesn't seem to be fair to allowing students and teachers during school to go and not quarantine, but yet athletes and coaches that are going in the summer on vacation, we're making them quarantine. That's all, that's the only thing I'm saying.
And I understand your question, but I'm saying, who are we to make the judgment call in putting other people at risk then to say because you went to a hotspot state, because you only stayed in and didn't go out but stayed in and didn't go to restaurants versus you who went to the beach? How do we know what Johnny did versus what Susie did? If the protocol is to quarantine, you're putting other people at risk.
What you're referring to is what was said about being in Excella today, and they don't require their 4,700 employees to quarantine.
But my company does.
Well, I'm just talking about what we talked about today. That's the only reason I brought it up. I didn't bring that part up. The only reason Dr. Walicki brought it up, they're not using that to suggest we do or don't. They were just telling us their protocol, which is even the hospital, if I'm getting this wrong,
No, you're
somebody
right.
tell me. Even the hospital doesn't ask for them to quarantine. It's up to them to be honest about it to themselves and to their fellow employees. I'm only bringing up that we have two situations going on with students and coaches, students and teachers, and they're different. And I'm saying make them the same. That's all I'm saying. And personally, I like the one for the students and teachers and we had talked about why. I just think it needs to be consistent, especially since people are vacationing. It's the only reason I brought it up. And I was hoping we could make it consistent tonight, but I do understand what you're saying, Dr. Walicki, and we can wait. So, any other questions or comments? Good.
Okay, so the next part of our plan will be an update in regards to our Hempfield Area School District Cyber Program, and Dr. Connor will provide that update.
Thank you, and I'll try to be brief. So, first of all, I have to make mention that the school district, the school board gave the administration the vision back in January, February, that they really wanted us to look at expanding our current successful cyber program in grades 6 through 12 down to the K through 5 level. So they really had the foresight back then that we needed to do this. Obviously, the COVID The pandemic really accelerated the process for us, but I have to make mention that I had a great committee that has been working on this since June, and it consists of teachers, administrators, a couple parents, and really have looked and investigated different programs, competition, and what would make an elementary cyber program at Hempfield Area School District a very viable option for our parents. And this is just to piggyback from the presentation that was given on July 20th. So it will not be quite as long, but I wanted to make mention back on July 20th, those numbers of potential students that were looking to go to our K through 5 cyber program at that point, based on pre-registration numbers, were 146. As of this morning, we're up to 310 across our K through 5 grade levels. So I think that you're seeing a sense of parents looking for another option, looking for some security. Obviously, these numbers are before the presentation tonight, so many of these numbers I expect to go down. However, I think it's something to pay attention to. Our next steps, we have orientation scheduled for tomorrow and Wednesday. We have two actually tomorrow, one at 1 o'clock, one at 6 p.m., and then Wednesday we have another one at 10 a.m. Anyone who pre-registered, any parent, received an email from me with a Google Meet invite to one of those sessions. It does not matter which one you would attend. In fact, we'll record those, so you don't even have to attend if it doesn't work with your schedule. But at that time, we'll be looking at the program expectations, looking at a typical day for a Hempfield Area School District elementary cyber student, what sets us apart from other cyber programs, looking at a learning coach agreement that we found to be best practice, and some next steps for what families have to do as we move forward. And going back to a question that Mr. DeAugustine asked earlier, we will be asking our parents at the elementary level to make a commitment for 19 weeks. The reason for that, we need to look at staffing. As I mentioned, 310 students, if we're pulling that out of our classrooms, we have to look at where potentially we may have to move staff around. Now, when I say a commitment, that's flexible, but we need to get a better sense out of those 310, how many we will have and have to staff for. Also, another thing that I have to make mention, and it's not on this slide, I have to really give credo to Mrs. Bryant. She spent a lot of time assisting me looking at the numbers, special ed numbers of students, related services of all these students who are interested, and how we will be providing services to them through this environment. And that's another reason why we're asking for that commitment, because it will take a lot of legwork, a lot of juggling, but I'm confident we can do that. After the Friday deadline, and we'll be sending out a Google form for that commitment. After that Friday deadline, we'll be looking at staffing, as I mentioned, looking at places where we could possibly shift some staff around to help address those issues. If we have to, we may come back to the board next week to look at whether or not we have to add staff. Mr. Wismar just gave me a strange look. So we'll hopefully not have to. And then we'll also be planning our material distribution event for late in August, where we will be distributing our Chromebooks, materials, curricular materials, et cetera, to our students. Very quick, very brief. Any questions?
If a board member has a question, just state your name and ask it.
Vince, you ready? Vince DeAugustine, just with the increase in the numbers, are we okay with the amount of Chromebooks we would need?
As of today, yes.
Yeah.
Other questions from board members?
Sonia Bradjick, question. When you're saying shifting of staff, wouldn't some of those same teachers then, would they be teaching this program?
Correct.
So then would they move from other buildings? Is that your,
We'll be looking, I'm almost looking at this as another school.
Okay. So you would then house those teachers or whatever, so they would downplay from other class sizes and then make?
We have to really look at being responsible with how our numbers are in brick and mortar. Obviously, we want social distancing in our brick and mortar right now, so that helps us. But we also have to look at what makes the most sense as to how we can allocate our staff to meet the needs. And that transition back into our brick and mortar, which we definitely want, we have to make sure we're planful because we have to have a teacher in there to accept those students.
Understood. Okay.
Other board questions?
Is there, Sonia Bradgick, is there also an option that these students could stay all year in the
Absolutely.
cyber program?
Absolutely, yes.
Other questions? Great job. Very good. So I did have a quick question for you. And it goes back to my initial statement in the beginning, and I just want to clarify a couple things. Maybe, Wayne, you might have to come into this. If one cyber student leaves our cyber school, goes to an outside cyber school, are we losing what, over 11,500 per student?
If that's regular education, yes. If it's a special education student, that number doubles.
And if there's 2 students, obviously in one family, that's 23,000. If there's 4, that's 46,000.
Yes.
There's a common misconception out there that it's my tax dollars. If I want to take my child somewhere else, my tax dollars pay for it. Well, I don't think there's anybody whose tax dollars covers that kind of a bill. It's everybody's tax dollars. There's also a misconception out there that the cyber schools purchase computers for you, printers for you,
Materials, yes.
get you the hookup, hotspot, material. Those are purchased by the money that comes from this school district, in other words, all the taxpayers. It doesn't come from the cyber school, it comes from the taxpayers. So my question to you is, we are looking at making sure that our students are able to get all those things. And for the needier students, the ones that don't have the hotspots, the ones that don't have the hookups, we will listen to them and try and help them the best we can as
Correct.
well.
We'll work with all of our families, just like we did in the spring, to make sure they have everything they need.
And this school board has had joint meetings with the township, and one of our major things that we wanted to work on was to work with politicians. And number one thing we talked about at that meeting in, what was it, February, January, was to try and get a better Wi-Fi system throughout the district to make sure that we have hookups for everybody in the rural areas. We're going to continue to work on that. So any further questions, follow-ups from board members? Matt, excellent report, thanks.
Thank you. And that concludes the superintendent's report.
Can I just make a comment? I don't know if I'm on here. This is Paul Ward. I guess there was a lot of kudos to the reopening plan, and I think just to reiterate some of the kudos to this, because as you said, this was something you started looking at in January, and I know there's been a lot of compliments toward it, but I wanted to throw my compliments to it as well, because I mean we're looking at a whole different perspective here because of the work that was done on the cyber program. And if we didn't have this, we'd be looking, it would be a much different picture. So I think it's very good.
Thank you.
Okay. Move on to hearing of citizens.
I have 2. They could be read now or at the end of the meeting.
Go ahead and read them now.
Okay. First one is from Linda Kaczynski. She has 5 statements, a couple of questions. Kindergarten and elementary students should wear masks when social distancing can't be maintained. Number 2, will adult visitors and teachers wear masks? Number 3, will children eat lunch in classrooms? Will gym be held outside? Number 4, kindergarten students need to attend full-time in the fall. This is a critical time in their development, and in-person instruction plays an important role. Number 5, I would like to know an anticipated duration time for half-day kindergarten in the fall.
So, Dr. Walecki, you covered most of that in your program. Why don't you answer the couple of the questions? Since this is a unique time, we don't usually answer hearing of citizens right then, but I think we should.
And I was thinking they could be answered during our town hall meeting on Friday. We could just incorporate
That's
those.
fine with me.
Yeah, because there may be other parents that have the same questions.
Oh, good.
So
All
we
right.
will provide the form to her tomorrow, and she can certainly submit them, or we can just populate them for her.
Okay. And the second hearing a citizen is from Meg Jones. Some of you might remember her that were on the board. She was our student rep on the board a couple years ago. My name is Meg Jones, and I graduated from Hempfield in 2018. While I am no longer a student at Hempfield, I felt the need to comment today because I am friends with current students and maintain relationships with many of my former teachers. I understand that things are highly uncertain at the moment, and I also understand there is no single clear answer as to how to deal with continuing school in the fall semester. I also know that this plan that currently stands may evolve and shift over the next few days as more concerned parents, community members, faculty, and students comment and question these next steps. All of this being said, there are things in the plan that undoubtedly need to change. There are two main points I want to raise about the current plan. One, that mask wearing is essential to student safety, and two, that more must be done to ensure social distancing. Masks are one of the most popular ways to help prevent the spread of COVID-19, and they are currently required in almost every business in the state. There's obviously strong science behind this, according to the Stanford Medical Center, the Center for Disease Control, the National Academics of Science, and many other medical research institutes. Masks are key in stopping our saliva from coming in contact with others. Masks are also incredibly important due to their ability to prevent particles from traveling as far or lingering as long, a feature that's essential since as many as 40% of people that could be your students and faculty, infected with the virus that causes COVID-19 may have no symptoms. I understand that your current policy requires students to wear masks when social distancing cannot occur, but it seems to leave a lot of gray area. Without a universal mask mandate for students, a requirement for students and faculty to be wearing masks at all times, in all classrooms and spaces, you cannot ensure that your schools will be free of contamination, not to mention confusion, chaos, and unnecessary social rifts. Masks should be required to be worn at all times, with obvious exceptions for students, faculty with medical needs, and there should be a clear course of disciplinary action for students who do not comply. Secondly, your plan calls for reduced capacity in schools and in classrooms. While I don't know how social distancing can truly be achieved in classrooms, I do know that even at reduced capacity, our rooms and hallways cannot uphold the professionally suggested 6 feet. I remember when I was a student, I was in multiple classes where students were practically sitting on top of each other, with one class not even having enough desks for all students. Combined with certain classes having speaking activities and students generally wanting to socialize and get close to one another, these plans, from the socially distanced cafeteria to the one-way halls, are flawed and urgently need reevaluation. In an attempt to be brief, I conclude here. Thank you for your time. I urge the board to consider these points as it moves forward.
Thank you, Pam. Appreciate it.
welcome.
And Solicitor's report, anything, Michael?
No report.
Thank you. And move on to Board Secretary's report. Scott, would you mind taking the motion that's on there for the minutes? Scott? Sonia, would you mind taking the motion on there?
There's,
What's that?
He's got you looking for.
Oh, okay, I'm sorry, Scott. I didn't know you were looking for him.
on mine, there is no
There is no number.
Minutes, isn't it? Yeah, it's July
None there.
20th. Is that for a motion?
Right. I think they're just looking for the number for the minutes, so we just want to approve them.
Oh, you
just
have to do the-
approval.
Oh, yeah, the minutes.
Yeah. Okay, I just moved that, Scott Lerner, I moved that approval of the minutes for July 20th.
Do we have a second? Second by Paul?
Thanks, Paul.
I thought I heard you. I'm hearing things. Scott unnerved me. I wanted to make sure he was okay there in the first part. I apologize to you. Any additions or deletions to the minutes? Any differences with it? Hearing none, all those in favor, please signify by saying aye.
Aye.
Any opposition? And that motion carries. Thanks, Scott. And we'll move on to Personnel Committee. Diane?
Thank you. Diane Cibatoni. I move that we approve P 9820, that Dr. Kimberly Revenak be approved and appointed to serve as the Assistant Superintendent for Elementary Education and perform the duties as described in the board's job description for the term effective immediately upon release of current position through June 30th, 2025, subject to the terms and conditions of the negotiated employment contract.
Second.
Second by Sonia. Any comments, questions? Anything? You pronounced the name really well too, Diane.
I ask her over and over.
After that rude comment by me, all those in favor, please signify by saying aye.
Aye.
Is there any opposition? That motion carries. Dr. Lick.
And Dr. Reefenak is with us this evening. Congratulations. We are very happy to have you joining our team. We know you will be an excellent addition. And look forward to your start date, which I will be contacting your superintendent tomorrow to learn how soon we can have you join the team here. So I will send out a letter to all of our staff tomorrow to introduce you, and certainly to all of our community members. Please look for a picture and an article in our upcoming issue of Headlining Hempfield, where we will introduce you to everyone. So I know that our staff and students are very fortunate to have you joining our team, as are we. So congratulations. Thank you so much. I'm looking forward to it. Thank you.
Thank you very much, and congratulations, Doctor. And that's it, Diane?
Yes, thank you.
Thank you, and we'll move on to Finance Committee. Sonia?
Yes, this is Sonia Brajic. I'll ask for the approval of F 7820. That reads that the authorization be given to the business office to set up a depository account with First National Bank for accepting online payments.
I second.
Motion by Sonia, seconded by Diane. Any comments?
Jennifer.
Or Jennifer, sorry.
Jennifer.
Okay.
See, we
That's what you get when you elect an old guy president. You can't-
It's hard to see down the line.
Yeah, it is. Well,
It's way down there.
anyway, any comments, any questions on this motion? Hearing none, all those in favor, please signify by saying aye.
Aye.
Any opposition? That motion carries. Is that it, Sonia?
No, the other comment I'd like to make is Mrs. Gibasevich is happy that there's somebody else whose name is harder to pronounce.
Anything else?
That would be all.
We'll move on the Policy Committee. Jeannie?
Thank you. Jeannie Smith speaking for the Policy Committee. I move that we approve PO 3820, which includes policies 146.1 on trauma-informed approach, policy 204 on attendance, and policy 815, acceptable use of internet, computers, and network resources. And these are accompanied by several reports, which are our ARs, and they're below.
Second.
Second, that was Diane that time. Any comments or questions? Jeannie, anything you have to highlight with that?
No, these are just being put on for 30-day review, and then we will, in 30 days, probably in our September regular board meeting, we'll approve them. Oh, it'll be longer than 30 days, but they're on for approval right now. And that concludes my report.
We didn't vote on it yet. No other comments or questions? Hearing none, all those in favor, please signify by saying aye.
Aye.
Any opposition? Motion carries. So we have no hearing non-agenda. We did that earlier. Any final thoughts or comments from board members? Hearing none, do I have a motion for adjournment? Motion to adjourn. Mike Alfieri,
Are we
motion to
going into
adjourn.
executive? Do we need to announce? Are we returning to executive?
We are, we can. Okay. We will be returning for an executive session afterward with no vote taken afterward, and we'll announce the time at the next meeting. So the motion of adjournment was for Mike. Who made the second? Paul. All those in favor, please signify by saying aye.
Aye.